I will start my speech in 3, 2, 1. Panels, ladies and gentlemen, handling pharmaceuticals by private originals would be very harmful for the society where they only pay attention to business targets, right? Recently, most pharmaceuticals field is controlled or owned by private companies or even regional governments. However, we believe it makes the deployment on each areas uneven. Panels. For example, in our current world, let's say a private pharmaceutics is Kimia Pharma in Indonesia. Kimia Pharma's branch isn't available or spread evenly in each area or province in Indonesia, which means and let us the distributions of drugs and medicine in Indonesia in each areas isn't even, right? Therefore, our house would make the research the development and their distributions of pharmaceuticals controlled and handled by the government or be nationalized. And our goal here is to creating a world where the distribution of pharmaceuticals is efficient and utilized. And our mechanism here is firstly, the government allocate funds for this project and keep it under control to avoid unnecessary interference. And secondly, we will hire people who are expert in their field to work on this project and by their assessment of their license. And lastly, this project will be reviewed directly by the state or by the government, right? Move on to our first arguments, which is the efficiency and controlling by the government or state. First point of discussion is the allocation of funds. On our side of the house, we will focusing allocate our money on first hiring experts and secondly running the productions. It is intended to run the production soon and will create change to the society, which means we'll save the society's pharmaceuticals use, etc., etc. And not only that, we will also focus ourselves to the well-spread pharmaceutical products evenly among the society, right? And we admit that this good system of the fund allocation will appear on both sides, since both owners need a good system to allocate their money. However, on our side of the house, it will be more utilized, which I will explain later. Our second point of discussions, which is the allocation of resources. A best result of production and products must have been handled by professionals or experts, right? Therefore, in one of our allocation of fund system, we include resources here as experts in one of the things that we focused on. In this case, we divide experts as scientists or pharmacists who are master of this field, right? However, we will make sure that the experts that working in this project is the best of the best, since the license of every profession is held by the government and the government hands every data that exists in this country. And the government will sort the experts by their assessment on the job license. Therefore, we agree that our side of the house has utilizing the fund better than the other side of the house. And the thing that I've brought up earlier will exclusively happen under our side of the house panels. Move on to our second argument, which is the accessibility of the pharmaceutical research, development, and distributions. First point of discussions. It is easier for governments to control if every pharmaceutical company needs a lot of requirement to carry out production or start distributing the products to the public, right? Such as licensing. And right before it is distributed or before it is produced, so as we admit, it takes a long time for licensing to take care of it, right? And also we agree that the issue of licensing is also what usually hinders the distributions of pharmaceuticals products. And on government's hand, it will be more controlled since it is fully owned, controlled by the government. From the beginning to the end, everything will be managed and financed by the government using the state money, and in the end the result will also be for the people, for the country, for the society. The difference is with private original ownership. If they have already invested capital, then they also need reciprocity or profits must be earned to cover the money that has been spent. And we conclude here that the exclusivity of handling the research, development, and distributions on pharmaceuticals will be handled better on our side of the house, where the approval of private and regional ownership will end up in the government's hand. And we also agree that the flow, if we still let the private or regional ownership handle this, will only delay the deployment of these products. And move on to our second point of discussions, which we agree that it is more accessible for the society. We believe that the accessibility of pharmaceuticals will be more accessible by the society on our side of the house. The accessibility of pharmaceutical products to be consumed by the society will also increase. However, if under the private originals control, they will prioritize the feedback or profits for the company. Basically they are more stick to the business. And this stick to the business thing also hinders or delay the spread of these products to develop. As I said before, they prioritize profit. So they will prioritize the distributions of products to more promising areas for their business to grow, right? Which leads the opposition side of the house to the uneven spreading and development of these products among the society. And we also admit that the increased amount of consumers of pharmaceuticals product will happen on both sides. However, the difference is on our side of the house, the development of society will increase evenly, not only in certain areas, panels. And panels, I have proven to you on how our side of the house will lead this project better, on how we will allocate the fund and resources by focusing on running the productions and hiring experts such as scientists and pharmacists. And also on how it will only delay the spreading of pharmaceuticals products to develop on their side of the house if we still let private companies or regional governments to run these projects. Therefore, I have the upper hand in today's debate, so I am never been prouder to propose today's motion. Thank you very much.